Drusen histopathology. Drusen, singular. Drus are extracellular deposits located at the interface between the RPE and Bruch membrane, figure 14.29a. Histopathology showing homogeneous eosinophilic deposits lying between the retinal pigment epithelium, RPE, and the inner collagenous layer of Bruch membrane. They are composed of a broad range of constituents derived from immune-mediated and metabolic processes in the RPE. Their precise role in the pathogenesis of AMD is unclear, but is positively associated with the size of lesions and the presence or absence of associated pigmentary abnormalities. Age-related drusen are rare prior to the age of 40, but are common by the 6th decade. The distribution is highly variable and they may be confined to the fovea, may encircle it or form a band around the macular periphery. They may also be seen in the peripheral and mid-peripheral fundus. Clinical features. There is a strong association between the size of drusen, figure 14.29 bf, and the risk of developing late AMD over a 5-year period. B. October showing drusen, arrows, C. Initial image. D. Same eye 4 years later showing an increase in number and size of drusen. E. Drusen with associated pigmentary abnormalities. F. Red-free image of E. Small drusen druplets, sometimes termed hard drusen, are typically well-defined white-yellow and by definition measure is less than or equal to 63 micrometers, less than half the width of a retinal vein at the optic disc margin, in diameter. Their presence as the only finding probably carries little increased risk of visual loss, unless associated with pigmentary abnormalities. Intermediate drusen are fairly well-defined yellow-white focal deposits at the level of the RPE measuring between 63 micrometers and 125 micrometers. Without accompanying pigmentary abnormalities, they carry only a small risk of progression to late AMD over 5 years, but this increases to over 10% if pigmentary abnormalities are present in both eyes. Large drusen are less well-delineated yellow-white deep retinal lesions measuring over 125 micrometers in diameter. The term soft drusen is sometimes used synonymously. As they enlarge and become more numerous, see figure 14.29 C and D, they may coalesce giving a localized elevation of the RPE, a drusenoid RPE detachment, see below. The presence of large drusen in both eyes is associated with a 13% risk of progression to late AMD over 5 years, but with accompanying bilateral pigmentary abnormalities this rises to about 50%. Dystrophic calcification may develop in all types of drusen. Pigmentary abnormalities. Hyper and hypopigmentation, see figure 14.29 E and F, not due to other retinal diseases associated with a significantly higher likelihood of progression to late AMD with visual loss. Tip: there is a strong association between the risk of developing advanced AMD, drusen size and macular pigmentary change. OCT medium-sized and large drusen are seen as hyper-reflective irregular nodules beneath the RPE, located on or within the Bruch membrane, see figure 14.29b. Fluorescein angiography FA findings depend on the state of the overlying RPE and on the affinity of the drusen for fluorescein. Hyperfluorescence can be caused by a window defect due to atrophy of the overlying RPE, or by late staining. Hypofluorescent drusen masking background efflorescents are hydrophobic, with a high lipid content and tend not to stain. Differential diagnosis: a number of conditions feature lesions similar to age-related drusen and at least some may have a similar pathophysiological basis. Doyne honeycomb retinal dystrophy, Malatia levantinis, autosomal dominant radial drusen, is an uncommon condition in which fairly characteristic drusen, figure 14.30a, appear during the 2nd or 3rd decades. Doyne honeycomb retinal dystrophy cuticular drusen, also known as grouped early adult onset or basal laminar drusen, not to be confused with basal laminar deposit and basal linear deposit in AMD, see dry AMD below, tend to be seen in relatively young adults. The lesions consist of small 25–75 micrometers, yellowish nodules, figure 14.30b, that tend to cluster and increase in number with time and can progress to serous PED. Cuticular drusen FA characteristically gives a stars in the sky appearance, figure 14.30c. FA showing hyperfluorescent spots, stars in the sky appearance. The condition has been linked to a variant of the CFH gene. Type 2 membranoproliferative glomerulonephritis is a chronic renal disease that occurs in older children and adults. A minority of patients develop bilateral diffuse drusen-like lesions. The CFH gene has again been implicated. Tip: in a patient with dry AMD and high-risk characteristics, prescribing a regular antioxidant supplement can reduce the risk of developing severe AMD.